Hi, everybody. We'll wait a few minutes for people to join. So I think we'll give it about 3 minutes until we start. So feel free to talk amongst yourselves. John, good morning.
Good morning.
And we are recording now, so a few things before we start. We do have about 10 to 15 people pre-registered. So that's part of why we're waiting. We know that people are signed up to come, and we'll just give them a few minutes. Welcome, Evelyn.
Good morning.
We will start in about 2 minutes. We just want to give people a couple of minutes to join.
Sounds good.
Good morning, Aaron. So Alexa, once it strikes 11:03, let's go. All right, I think we're ready.
All right. Hello, everyone. My name is Alexa Colella. I am a graduating master's student at the University of Iowa and an intern at Album Health. Today, we are bringing you the workshop Improving Mental Health Through Evidence-Based Self-Management. I'm going to be moderating this workshop, looking at the Q&A section for any questions. This is going to be a 45-minute presentation with 15 minutes set aside at the end for any questions. Please remain muted unless you do have a question. And again, the recording will be available after the completion of this workshop. So a little bit about our speaker today, Aaron Quinn. He is a licensed psychologist who has a passion for health and sports psychology. So he's very passionate about this topic today. He has a background in private practice, consulting, teaching, and is the co-founder of Album Health, as well as the CEO.
Thank you, Alexa. Thank you, everybody, for joining. And one thing, we do have the controls set up so you can unmute and ask a question if you'd like. Of course, every presentation is better if there's some dialogue back and forth. So please chime in if you have a question, but also at the end, we'll designate about 10 minutes to Q&A. So if you'd like to put the questions in Q&A, like Alexa said, that would be great. Yes, I am a psychologist. A couple of other information about me. I've worked in private practice, government consulting, teaching, and I am the CEO and co-founder of Album Health. And personally, I have 2 kids. I live on a farm now in Iowa. I'm originally from the East Coast, from the ocean, so I've gotten to experience 2 ecosystems in my life, and I'm really excited to share and talk about the topic of evidence-based self-management and using that to address mental health with you all. So a couple of disclosures here from me. Number one, I am the CEO of Album Health. So I do have proprietary interest in Album Health, the company, and we do use evidence-based self-management as an approach in our product set. So I will not be talking about our product and really what Album Health does. Our product is called Your Emotional Health Score, yes, but we'll be touching on the research and the literature related to evidence-based self-management. So I just wanted to disclose that role. In general, this presentation will be sort of a hybrid. I definitely am biting off more than I can chew. It's dense, so we'll move quickly through a lot of slides, and it's really the 101 on self-management. I'll be giving you a lot of basic information and doing deeper dives in later months on some of the topics we talk about today. And it's really a presentation that I hope the people watching this, whether live or via recording, it's probably going to be a lot of people who are in the helping profession and are providing care for others. So I hope you take this information and it can help your practice with others, but also it's meant to be something that you can apply to yourself. So both self-management related to you and others. And then one last thing, there is an hour of continuing ed available. Of course, the disclosure there is check with your board. Every board has different rules and regulations. I'm a psychologist, the presenter, the material, et cetera. But this is available for 1 hour of continuing ed. What you need to do at the end of the presentation, once you've viewed this in its entirety, is complete a quick survey, and then Album Health will issue you a certificate. So that's it. Here are the learning objectives today. Number one, we'll discuss mental health management. So in evidence-based self-management, of course, evidence revolves around measurement. So we'll discuss how mental health is measured and some trending towards more comprehensive and function-based assessment. The other learning objective is that you'll be able to articulate 2 different ways or styles of measuring mental health. We'll then get into some of the components, core components, the 6 pillars of lifestyle medicine. So those are real fundamental to self-management, as these 6 pillars drive a big chunk of health. So we'll spend a lot of time on the 6 pillars of lifestyle medicine today. It's sort of what you do within lifestyle medicine. And then we'll talk about, what these things do, like sleep. How does that relate to mental health? So hopefully you'll get information about how the components of self-management affect mental health and why they're important. We'll do a deep dive into goal setting. That's one component of a self-management program, one that I enjoy quite a bit. So we will discuss that. And I hope that you will be able to explain the principles of goal setting as well, and then best practices. So in the end, and this is where we sort of settle in this talk, is you learn about measurement related to mental health, because we are using self-management to move the needle on mental health. We move into some of the things you do within self-management, and then we move into doing it and how to make it work and how to develop programming. So very applied at the end and bringing everything together. So we'll start with measurement. And in the mental health world, the typical way that we measure mental health is through symptom rating scales. So you all are probably fairly familiar with this. Most scales measure symptoms of depression, I feel sad, or anxiety. I can't stop worrying. The standard measurement tools are the PHQ, which measures mood/depression, and the GAD, which measures anxiety. People rate symptoms on a Likert scale. Scores are calculated, and it places you in a clinical category, meaning your symptoms are normal, or mild, or moderate, or severe, or very severe. that's, and I have some of the examples here. One thing to point out, in this presentation, you will receive a copy of this. We will distribute it through YSS as an organization, and it will be available in this presentation. There's lots of links. So lots of links to information here. The PHQ GAD-7, DAS-21, and the CESD are some of the prominent symptoms rating scales. These are really great. They're simple. They're free. You can go take them. You can typically score them yourself, and it's a great way to really track mental health through pure symptoms. Some of the disadvantages of this, and again, this is a standard way of practice. I always found that when I'm working with my clients and I say your score is an 11 and your depression is moderate, there wasn't much meaning. And I say, oh, your score went from an 11 to a 9, and they respond, is that good? And I go, yes, that means you went from moderate to mild. And there's just not enough meaning or understanding. Recall in working with clients, what was my score again? Okay, 9. Did you say that's good? Mild, moderate? Categories don't inherently mean much. And in the end, another disadvantage is that mental health is really complex. My real take and where some of the measurement is trending is we want to measure symptoms, but also functioning. So that's where we move into sort of, I think, some of the better ways that we are moving towards in working with measurement of mental health. So couple of examples here of why these might be better options for you, for the people you work with. Number one, if you are measuring both mental health symptoms, maybe some other symptoms, and functioning, you get a much more complete picture. You have what the PHQ and the GAD offer, but you're also, in the end, many people have fairly significant mental health symptoms and they function quite well. You have actions that you can take. And the scores tend to be on a 0 to 100 scale. That in and of itself, you're at an 82, people know what that means. That's a B from school. So it's something that people remember. The score means something to them. They see it. They want to move it, typically up. And it has, action items that relate to functioning, which in the end, functioning really matters in people's lives. So if they're able to go and do social things more, that makes a difference. If they're able to, have less pain, the RAND SF-36 is a great tool as a way of measuring health and functioning. And you see the multiple domains that are measured through that tool. So there are symptoms there, but we're looking at emotional well-being. We're looking at role limitations. Are you able to do what you want to do? Really, really important as we measure. Also the SQ. So that's an inventory that we developed here at Album Health, and that uses the PHQ-4, which is 2 items from the PHQ and 2 items from the GAD. But we look at functioning across health domains. So how's your sleep? How's your stress? How's your nutrition? How's your exercise? And that's a way that we get a proxy and also help people with goal setting and take actions on their health. Some of the advantages of doing this more complete assessment, again, it's simple. The tools are validated, they're free. But it also tends to be more understandable and meaningful, as that is discussed before, and more comprehensive. And in addition, there are actions. So in the case of the tool that we use, if sleep isn't well, if you're not sleeping well and that's a part of your score, it drives you to work on sleep. So it gives you direction as you're assessing. Some of the disadvantages, these tend to be longer items. Ours is 19, the SF-36, 36. So it tends to take more questions in order to get at the overall health and functioning. So I'll start there. That's the beginning of evidence-based practices. You have to have something you're measuring. You have to have that North Star, and I really encourage you to consider at least using some of the more comprehensive measures. Now we'll move into self-management and really start with what it is. My favorite definition is number 3, technically self-care and self-management, somewhat interchangeable. I know I'm some people will take me to task for that one, but Lowell Levin is a public health leader, 80s, 70s, 80s, 90s. He's actually lived on my block when I grew up and kind of a mentor and got me into this space. But he and Ellen Eidler define self-care as those activities an individuals undertake in promoting their own health, preventing their own disease, limiting their own illness, and restoring their own health. Boom. So this is what we really want to be empowered to do ourselves, but also with the people that we are helping take care of, is that people are taking care of their own health. They're taking action. They have agency. And they have the tools that they need to take care of their health. And you know, that becomes important on many levels. So that's what we're talking about here with self-management. And when I work with my people, and particularly when I was in private practice, that's really what I seek to do. That was really important, that people were doing what they were supposed to be doing and have better understanding when we were done, how they could take care of their health. So if there are any questions, please let me know, but you now have an understanding of the ways to measure mental health, I hope. You understand what self-management is and why we're talking about it, because it's really important. And if, as people can self-manage, we'll get into some data later, everything improves. Outcomes are better as self-management improves, okay? Now we're going to shift gears. So get into components of a self-management program, both your own and people you work with. And I want to park on lifestyle medicine. And the 6 pillars of lifestyle medicine are core to a self-management program. So 6 components are eating a healthy diet, exercising regularly, keeping your stress low, avoiding risky substances, sleeping restoratively, and maintaining positive social connections. This is a component of medicine. There is a department at the University of Iowa here in Iowa. And the general, what you hear spoken about quite a bit is that lifestyle medicine is both preventive, so it keeps conditions from happening in the first place, but it's also a part of condition management. And that basically 80% of most conditions is wrapped up in these 6 things. So when you talk about self-management and you're putting together programming, both for yourself and others, you have to really start here. So now we're going to do quick dives, not deep, quick dives into these 6 areas. First, eating healthily, eating a healthy diet. What does the research show? This one, one thing I didn't say about myself, I am a bit of a health hack geek. I listen to too much about these things. I read too much about these things. Nutrition is a really hot button for many people. I am associated with quite a few people, many of them health practitioners, a few of them physicians, who are pretty clear that this is where you start health. Health begins and ends with what you're feeding your body. The research I would say is pretty good. There's definitely been demonstrated correlations between what you put in your body and the prevention of conditions and incidence of conditions as well. And I think that's where we've landed. The problem with nutrition-based research, up at the beginning, I give you links to reviews. I try to stick with meta-analyses and literature reviews, so you can link and you can dive in and you can do your own search as well. It's really hard to do randomized controlled trials on nutrition. So some of the evidence base lacks, pure science, but definitely correlation. What does the research and literature show are best practices? I'm not going to pick too many sides here. I'll just tell you what the research shows. One of the most important things is energy balance. What does that mean? We know that most important is that you're not undernourished, because if you're undernourished, all sorts of problems happen related to health and wellness. And if you're overnourished, you run into additional problems. On the undernourished side, it's death, ultimately, if you're not getting enough food. But if you're getting too much food for what your body needs, of course, that creates issues like obesity, diabetes, etc. The goal of nutrition and best practice is to maintain energy balance. So your body needs these nutrients, your body's needs around this many calories, and you're getting that. I would say there is clear consensus around the importance of doing that. A whole nother talk is about how to do that. I get that that's difficult. Couple of the other things I'll just glance over pretty quickly. In general, Mediterranean diet is the most evidence-based. Most, both what it does for health, but also the doability of it. Mediterranean typically wins. There is a lot of emerging science around the DASH diet, which is for hypertension, the MIND diet, which is for cognitive issues and Alzheimer's disease. And then the real one emerging is the keto diet. I've done all these. I'll share that personally. I try everything under the sun. I love to understand the way things feel. I did keto fairly recently. I did it for a few months. It is hard. Whew. It's really, really hard to get in ketosis and stay that way, but there's really good evidence about what it does, particularly for mental health. So I encourage you to kind of take a deep dive, figure out what works for you, etc. My closing statement around best practices, you have to understand that nutrition is highly personalized. You have to figure out what makes you feel good, what you'll do, what works for you. And I think that really is the best science. It's an N of one approach. So in self-management, how do you put nutrition into action? Here are a few tips and things to think about. You always have to think about what and how. So what helps you feel good? What works for you? And how do you eat? Intermittent fasting is an approach where people are manipulating eating windows. Energy balance, there's a great book if you are looking for sort of a go-to around nutrition and sound science and sound guidance and doability. Intuitive Eating is really the gold. There's a link to Amazon actually to purchase that book. And Intuitive Eating is a great one around energy balance because it really helps you learn to eat when you're hungry and stop when you're full and feed your body what it needs. So it's a very mindful approach to eating. Another thing is when you're looking to put more health into your diet and do things that feel good for you and stick with it, it's an important thing to not label foods as good or bad and to sort of relax the food police, which is discussed in Intuitive Eating. And a great way to think about food is good, better, best. My friend Jenny Weber, who's a dietitian in Des Moines, is really strong about that's the way you think about food, good, better, best. And when you do that, everything is good. And there's this sort of global acceptance that frees you to eat in a more healthy way. So second pillar, exercise. This is a great one. One thing here, I skipped ahead a slide. The best exercise is the one you will do. That is clear from the literature. This link here is from a podcast that we actually did at Album Health with Jacob Meyer, a professor at Iowa State University in the Department of Kinesiology. And we talk lots and lots about various nuances within exercise, but in the end, we conclude that the best exercise is the one that you will do. Exercise is incredibly effective. My background went to Iowa State, PhD in counseling psych, but before that, I was a master's in exercise science, which is now kinesiology at Iowa State. This was my original passion, is looking at how exercise affects mental health. And exercise does, it really does. It rivals psychotropic medications. It rivals psychotherapy, really strong effects. So whether it's yourself or working with people, movement is key, absolutely key. CDC recommends these recommendations here, 150 a week minutes of cardiovascular at least per week, less if it's vigorous. strength training at least 2 days. So what they're basically saying is do some things for your heart, do some things strength training. Something called Zone 2 cardio is really emerging, and different things around strength training. That's for a later date, but these are the basic rules. Get that heart up and going, most days, and mix in that strength training. Putting exercise into action, I'm going to hit on a few things over and over again, because within each of these pillars, it's important to have an evidence-based approach, which means you're measuring something and you're doing different behaviors and you're looking at how that's working for you. Most importantly is to set a goal, label why. Simple things like, why do I want to exercise? Well, I want to exercise because when I have grandkids, I'd love to be able to out and go have a baseball catch. Okay, therefore, I need to do these things that really matters to me. Having goals and then tracking progress. I present a few links here around some of the things that you should consider measuring as products of exercise. Things like VO2 max. So that's basically your body's ability to convert oxygen to energy. Strength. Links here to how to test VO2 max in the norm table. Strength. My personal opinion is the squat is the most functional exercise you can do. So there's a squat test that can help you measure strength. And then range of motion is the standard sit and reach test, how flexible your hamstrings are, which of course affects lower back pain, etc. But if you're paying attention to your cardiovascular health, VO2 max, your strength via squat, your range of motion with the sit and reach test, and you're moving the needle on those things through your exercise, you're going to find out that your functioning gets better and better and better. And I think it's important to think about those 3 areas in positioning exercise to improve your health and mental health. Big one. All right. Third one, keep your stress low. This is kind of a no duh one. Everybody knows to keep stress low, but the science really is quite strong. Stress levels do predict physical health issues, emotional health issues, of course. This graphic shows some of the relation between, stressors as being and stressors as being short-term and situational easily convert over into things like anxiety and anxiety disorders, which are more chronic. So you really want to nip that in the bud as much as you can and have some sort of stress routine. Approaches that work in lowering stress, I highlight 2 here. Mindfulness. Mindfulness, whether you're doing mindfulness-based cognitive therapy or mindfulness-based stress reduction or anything, doing it guided through an app, there are a lot of great resources around mindfulness, and having a daily mindfulness practice is generally shown to be effective in reducing stress. The real Cadillac around stress is cognitive behavioral therapy. The premise there is that thinking leads to all sorts of thinking is sort of the root of mental health issues. And if you are aware of your thoughts and examining them so that they're rational, that creates a cascade of changes, which the research clearly shows. CBT is pretty easy. There are a lot of self-help books out there. Mind Over Mood is the classic, but those are 2 practices that I think are very helpful. Exercise, of course, helps a great deal as well related to lowering stress. So how do you create a stress management plan and get things into motion? Well, again, measure it. Measure stress. A few tools here, the DAS21, linkage, the YesQ, those all can help you measure your stress levels. Resting heart rate can be a decent proxy. And something called heart rate variability. So if you're like me and you have wearables, in fact, I have 2, I am tracking heart rate variability constantly. I'm pretty consumed in my heart rate variability, and that's a measure of how well my nervous system is functioning, which is a proxy for stress. So if you're a wearable person, that's a great thing to do to measure stress from. And, the plan, consider the prior slide around what some ideas that you can do. And again, repetitive in all these slides is set the goals, set the why. When you set goals, we'll get to this a little bit later, it's good to look at them daily, whether it's sticky notes, whether it's in an app, whether it's on a whiteboard, and definitely track behaviors. Fourth, substance use. This is another straightforward pillar. The statement is avoid use of risky substances. I probably don't need to expand on that. The one thing I bold here is that the evidence does not support that marijuana is a healthy substance. I just want to say that marijuana is included. I'm not anti-marijuana. Marijuana is helpful for addressing symptoms. See, I put this here to prove there's certainly positive effects from marijuana, like pain relief, glaucoma relief. Those things are obviously evidence-based, but in general, marijuana is considered a risky substance with a lot of negative effects. So really simple to avoid. Another thing here, red wine, that's a part of the Mediterranean diet. The research has really converged at this point in saying it's not the red wine that's causing effects, positive effects from the Mediterranean diet, particularly related to mental health. It's all those other things that people tend to eat socially, high omega-3s, all that. So unfortunately, I do drink red wine though. How do you put a plan into action? This one is a little bit different than the others. I really encourage, if people are trying to avoid risky substances and having some difficulties with that, really step one is seek care from a health professional. That's really important to make sure that you're doing it with professional supervision. So I want to make sure that's there. And then from a measurement perspective and using your evidence, typically you measure success through abstinence, through quit days, whatever the term might be related to the substance. That's what we do. One thing to point out, still the literature supports that AA is the most successful behavior change program in history. So still going strong, and many of you have heard of that, know the 12 steps, and that's a helpful self-management strategy in and of itself. Fifth pillar, sleep. Sleep has what's called a dose-response relationship with mental health. That is, the higher quality sleep, as sleep gets higher and higher quality, mental health improves. And it's almost as though you can't get enough quality sleep. This is also considered the #1 performance enhancing drug in the sports world. This is considered the complete foundation to mental health by many researchers and people I listen to. I think consensus is, if you're going to do one thing from these 6 pillars, you should be doing all 6, of course, to get the most effects in improving your mental health. But if you really have to focus on one, sleep is maybe the winner. So sleep recommendations based on the science: hours, 7 or more for adults. As you're younger, of course, sleep hours increase. You really should be monitoring sleep quality. You can do that as simply as how rested do you feel? How much energy do you have typically in a given day? Do you need to nap? Things like that. But again, if you're a wearable person, all wearables have sleep trackers, usually show you the stages of sleep, usually have some sort of metric around the quality of your sleep, and can really be a guide there. If you're having chronic difficulties with sleep, again, I do think it's important to seek medical care. Sleep apnea is obviously quite prevalent. There are great interventions for that, and other sleep disorders are more prevalent than you would think, in addition to sleep apnea. I'm on the record, and I encourage people who are, serious about self-management, both self and helping others. Trackers are great. I mean, we have the ability to track these sort of things now, exercise too. So consider investment in one. They're really cheap. I mean, I think the cheapest Fitbit right now is $29, $39, and they give you a lot of great information. So something to consider. So putting sleep into action and sleeping restoratively, there's something called sleep hygiene. And the link is here that takes you through sleep hygiene. But this cluster of behaviors right here in front of you is the most robust way to sleep restoratively. This is it. Not any medication, not taking a shot of whiskey before you go to bed. That doesn't work actually. That helps with onset, but not quality of sleep. But these are the things to do if you really want to create restorative sleep. Limit food before bedtime. 3 to 4 hours before is ideal for stopping eating anything. No alcohol. Alcohol affects sleep negatively. And then the last one is something called sleep efficiency. Basically, what you're seeking with sleep hygiene is when you are in bed, you're sleeping. So pretend I hit the bed, I fall asleep immediately, I never wake up at night, and I've slept 8 hours and I get up and off I go. That is 100% efficiency. Typically, I hit the bed, takes me 15 to 20 minutes to fall asleep. I wake up a couple of times at night, then I get up. So, let's say my sleep efficiency actually is somewhere between 90 and 94% on most nights. But you're seeking 100% with efficiency. So what does that mean here? If you're not sleeping, don't stay in bed. Most people will sit in bed and ruminate and toss and turn, and you're not supposed to do that. 20 minutes is the most time you're supposed to stay in bed without sleeping. So go read a book, go watch TV. You're supposed to do boring things, not supposed to look at screens actually. But that's the most important, I think, concept of sleep hygiene is never stay in bed without sleeping. I also do some linkage to supplements. There are plenty of supplements that are actually really helpful. Magnesium, glycine, melatonin, particularly for jet lag. There's a link to, I consider him my friend at this point, Peter Attia, around what he does around sleep and some of his practices. So check that out. The last component, the last pillar of lifestyle medicine is social support. So the research does show that having strong social connections, strong social attachments, that's a protective factor related to poor emotional health. So basically, if you have good relationships, that will keep you in a pretty good place related to mental health. That becomes tougher. I don't know if you're like me, I'm 52. Social used to be something I craved and I was constantly doing this. I've gotten older. I mean, you just become more reclusive. I live in the middle of nowhere now as well, so that contributes. But it is something that I actually do schedule. So one thing is you got to schedule the activity. If it appears on your calendar, probably many of you will do it. So that's one recommendation that's made. Focus on quality versus quantity. And then these are from the CDC and from the literature. Paying attention to others when you're with them, not technology, that's a challenge. I think we all witness that every day, that people have a tough time not looking at their phones when they're with other people. But those are a few of the recommendations to maintain connection. Like many of the other areas, an evidence-based plan to improve social connectedness has to do with creating the plan. Okay. Measuring it, the RAS, the relationship scale, is one way you can measure quality of relationships. So how am I doing? What am I doing with the plan? Review the plan daily, set intentions daily, track the behaviors, and really scheduling our best practices around putting social connection into action. So those are the 6 pillars of lifestyle medicine, and I consider those really the pillars of health and the pillars of effective self-management. And I encourage you all to take some of this information and to run with it. That's a really, really, really quick introduction on all 6. So I did not do them a service, but hopefully you know them now. That was one of the learning objectives, and you can speak to them and maybe even create a mnemonic where you memorize them. Um, now we're going to move into, you can measure mental health. So you have your marker. You understand some of the meat to a self-management program. Now, how do we put it together? How do we do this? How do we get ourselves, and this leans a little bit more towards helping others and even helping organizations improve self-management. And here are some of the facts and some of the practices. So number one, self-management. Most of the literature is around supportive self-management in clinical settings, in healthcare staff and professionals working with patients. When patients and clients are effectively self-managing, every outcome improves. So physical health outcomes improve, mental health outcomes improve, precursors to the health behaviors increase, precursors to the health behaviors increase, things like self-efficacy, outcomes expectancies. All of these things improve through a successful self-management program. So what does the literature say are the components of a successful self-management program? Number one, you're regularly assessing. So again, it's measurement. You have to be active in measuring important outcomes. You have to set goals. So once you're measuring things, what are the targets? What are you shooting for? You have to provide support and problem solving so people can feel like they can solve their own health problems, that they have access to resources. Education, again, sort of similar, but people feel educated on prevention, the 6 pillars, conditions they have. You have to, in a program, disseminate evidence-based practices. I think I'm doing that right now. Is what are evidence-based practices? I talked about pillars. I'm talking about the structure to programming that has to get out to the people. Okay, I need to work on the 6 pillars. I also need to manage my diabetes. What does the evidence show I need to do? That needs to get to people consistently. Incentives, wonderful driver of health behaviors, health activity, and what we call engagement. Incentives have to be in place. That's really what the research shows, to get people to self-manage. If you're doing it on your own, the best incentive is typically that why, and functioning and what that enables in your life. You have to bring programs to people. So it's easiest if self-management comes in the way of a program. It's put together. It's doing the measurement for you. It's giving you the education. It's giving you tools to set goals and track and all of those things. That leads to better self-management and all the related outcomes. And then any self-management program has to connect people to healthcare professionals and make more effective use of healthcare professionals. So a workplace example is get people to the AP. The EAP is there for most employees. There are a lot of resources there, but people need to be oftentimes pointed to it. So again, quick overview on sort of the 8 components of effective self-management programs. I want to talk about goal setting, one of the components here a little bit further. It's a fun one. It's easy, simple principles. There's a nice acronym here, SMART, but always fundamental with goal setting. So with yourself and with other people in promoting self-management, this is a big one. So again, part of goal setting is label the why. Where does this person want to go? What creates that fire in their belly? What really means something? And then the goals come from that, right? So if somebody wants to be the best father possible, boom, that's the why. I want to be a great dad and I want to be able to do these things with my kids. Okay, what are the specific goals? Well, I need to improve my depression. I need to get my A1Cs in this level. And the research shows never set more than 3 health goals. So that's tops. It could be 1, it could be 2, but never more than 3. You want to work out to, okay, where do you want to get depression? Where do you want to get your A1C ultimately? And then work your way back to the present moment. So there's a time component to goals, and SMART stands for specific, measurable, attainable, relevant, or realistic, and time bound. All those components have to be a part of the goals that you set yourself and with others that you're helping. It's important to set outcomes goals. I talked about A1C and depression and anxiety are here. Process goals. So if I want to improve my depression and A1C, what do I need to do? What are the daily behaviors typically that I need to do? And then you need to monitor the why, monitor the goals daily. That's something that needs to be looked at daily, the research shows. And then monitor progress weekly is the best time. So what's the A1C this week? Now, I know you get A1Cs typically every 3 months, but you do a depression rating scale. You do the RAND, you do the ESQ on a weekly basis. So you're looking at, in an evidence-based way, what's moving the needle. So really quick, how to position goal setting within a self-management program. And then in general, we talked, these are what the literature shows are best practices within self-management. I talked about the 8 components of a program, but these are the overall best practices related to positioning it and improving mental health is what we're focused on here. Number 1, you have to start with how you're measuring mental health. You cannot have the goal to improve, better manage your mental health, self-manage mental health, your organization, others, without how are you measuring it, right? That's the starting point. Number 2, review the 8 components of the program and make sure all of those pieces are in place, at least most of them. Number 3, programming has to be accessible. So when you've decided on the program you're going to use, people have to be able to get to it. That doesn't happen quite a bit. You know, some have access to programming and others don't. You have to understand populations are diverse. Make sure that you choose programs that offer equal accessibility. You've got to work on culture. This was part of the 8, but culture drives mental health. And there is a bi-directional relationship between the person within the organization and the organization, but the culture really influences strongly mental health. And again, incentives need to be in place. Self-management program has to include lifestyle medicine, and I consider that real meat around what people need to be doing. Condition management strategies also need to be in place, right? So if you're managing, you need to manage conditions, but specifically, so that's oftentimes medications and other medical biological interventions. On the mental health side, psychotherapy is of course, the most evidence-based, and the biopsychosocial approach is how you approach things there. And then you need to track the outcomes continuously. So the scorecard approach really applies in evidence-based self-management. So from measurement down to what are in addition to the mental health outcomes, what are the other outcomes we're tracking related to success of the program? Participation, engagement, health behavior activity, satisfaction, right? Incentives, and how those are relating. All of those components need to be a part of a scorecard related to evidence-based self-management. And when you have that in place, then you are, of course, self-managing in an evidence-based way. So thank you. I went 4 minutes over. Apologies for that, but we did start, I think, 4 minutes late. And yeah, any questions about anything that was discussed? Alexa, I don't know if anything popped up as I was talking.
I'm not seeing anything currently. Just a reminder, people can use the Q&A function to send their questions or come off mute.
Questions, comments? Anybody? Okay, going once. going twice. A few things to cover here. I did have two pre-questions. One was about red wine. I already talked about that. Red wine is in the Mediterranean diet. I won't go back to the slide, but it actually does appear on the pyramid. Unfortunately, it doesn't seem great. Everything in moderation. And then exercise with specific exercise results. And again, I think the general rule is what you do is the best. That will trump any specific type of exercise. So, yeah, a few things now. Alexa, you know, the recording will be available. So once this workshop is done, we'll get the recording and we will put it in this invite. So it will actually be attached to this on your schedule. And then Anna, I see that you're here. I'll also send you a copy. And if you wouldn't mind distributing it to your population, that would be great. I think she said yes. And then the last thing is on continuing education. Just a reminder, to get the 1 credit hour, you have to view the session in its entirety. And thanks, Anna. You have to complete a survey. Link is here, takes you to SurveyMonkey. I believe it's 7 items, really simple. Remember one of the items has you enter your name and your email address. That is how we will get you your certificate. So please don't forget to enter your first and last name and your email address. Our surveys are not collecting that automatically, so we don't have that information on you already. And we will make this available for 1 unit for a month. So we plan on doing these workshops monthly. Most will be deeper dives in specific areas. This was a general overview on self-management. And once the next one comes, it's basically expired to go into this one and get the continuing ed unit. So those are the general rules. And then please, again, check with your own licensing board and applicability. All right. I think that's it. Thank you all. Have a great day and great rest of the week. Bye-bye.